This video is about the immediate cord care function of the nurse, wherein she clamps and cuts the cord immediately after delivery. And these are the materials needed for this procedure: a newborn mannequin with cord, a calistrate which is clamped on the cord, a suction bulb wrapped with gauze or operative sponge, a square sheet which was used to receive the baby after delivery, sterile gloves, flannel, povidone iodine, lined hypotray, a waste receptacle, stethoscope, an UPGAR chart or a documentation sheet with UPGAR. Take note, the following materials must be wrapped as these are considered sterile: a steel medicine cup, 5 swab sticks, umbilical cord clamp, 5 pieces of gauze or operative sponges, a kidney basin, and surgical scissors. Start the procedure by performing medical hand washing and open gloving. Then, perform 5th minute UPGAR scoring while drying the baby. UPGAR stands for appearance, pulse, grimace, activity, and respiration. In checking the appearance, look into the color of the baby. For the pulse, check for the heart rate. For the grimace, check for the reflex irritability. Reflex irritability is a term used to describe the response of the newborn to stimulation, such as suctioning and slapping of the foot. For the activity, check the muscle tone. And for the respiration, check for the respiratory effort. During the return demonstration, the teacher will be the one to tell you the findings for the UPGAR, and you will be the one to determine the score. Suction secretions as needed. Notice how proper suctioning is done. Press, insert, release. Again, press, insert, release. Change the square sheet or flannel of the baby with a new one. Then start opening the necessary materials. Do not forget to pour povidone iodine on the medicine cup to soak the swab stick to the antiseptic solution. Notice that the surgical scissors and the umbilical cord clamp are placed inside the kidney basin. For the OS or the gauze, do not place it inside the sterile kidney basin in order for it not to be spilled with blood. Begin by uncoiling the cord if and when the umbilical cord is twisted. Then twine down the cord towards the centermost part of the Kelly. Because if you coil the cord towards the tip of the forceps, the tendency is that as you twine down, the twined cord will slip off. So again, twine the cord down towards the center part of the Kelly. One guideline that you need to remember in performing immediate cord care is to make sure that you're not going to pull the cord as you hold it. Using the first swab stick, clean the base of the cord in a sun rays manner. Make sure that you're not going to miss any area. Then, discard the first swab stick on the waste receptacle. Using the second swab stick, disinfect the cord from the base going up. Then, clamp the cord 1 inch from the base using the plastic cord clamp. You will hear a clicking sound once you have locked the cord clamp well. Notice how the gauze is folded. Place a gauze on the base of the cord. Then, support the plastic cord clamp by placing your middle finger and index finger immediately below it. Then, make sure to cut on top of the umbilical cord clamp. Cutting below the umbilical cord clamp will defeat the purpose of clamping the cord, and it will lead to bleeding. Place the cord and calustrate on the kidney basin. Remove the gauze and discard on the waste receptacle. Use the third swab stick to disinfect the cord clamp. And pay particular attention how the cord clamp is disinfected. Then use the fourth swab stick to disinfect the cord from the clamp to the base of the cord. Using the fifth swab stick, disinfect the base of the cord using the sunrays manner. After performing cord care, this is the time for you to assess the number of vessels present in the cord. Take note, there should be 3, 2 arteries and 1 vein. Perform 10th minute APGAR as necessary. Then, the baby will now be endorsed to the assist nurse.